just gonna wash my hands before we get started. My name's Christian. I'm gonna ask you to remember that for later. Can you tell me your name?
Fred.
Okay, I'm gonna be your student nurse today. I'm gonna be doing your overall head to toe assessment, if that's okay with you.
Yeah.
Can you tell me why you're here today?
Just for a head to toe assessment.
Okay, and no complaints about any.
No, got nothing wrong. Just
Okay,
wanted to check
so
that.
he's in a good state of health. I'm gonna ask you a couple questions. Can you tell me your age
I'm 19.
and your race
I'm white.
and your gender?
I'm male.
And can you tell me your height and your weight?
I'm 6'4" and 195 pounds around.
Okay, so before we calculated his BMI, and his BMI is 23.7, which places him in a normal weight range. Just looking at him, his dress, grooming, and hygiene seems to be appropriate, so he has no complaints. His general behavior seems to be cooperative. His affect is animated. His thought pattern is logical, relevant, and organized. He's answering my questions, so his speech is articulate. Can you tell me your name, your full name?
Frederick Hutchins Whipple III.
And can you tell me where you are today?
I'm in the nursing wing.
And can you tell me the day of the week it is?
It's Sunday.
Okay, so he's an alert and oriented ×3. And then next, do you remember my name from when I told you earlier?
Yeah, Christian.
Okay, and can you just tell me who the president was before Joe Biden?
Donald John Trump.
Good, good. And I'm just going to give you a proverb, and I want you to just interpret your meaning of it. The grass is always greener on the other side. What would you interpret that as?
Don't be jealous because other people, their situation may seem really good, but in reality it's not.
Good. And it's a little bit chilly outside, so before you go outside, what would you probably put on?
Probably put on sweatshirt, jacket.
Okay, that's good. So we have a 19-year-old Caucasian male. His BMI is healthy. His intellectual capacity seems to be appropriate. His general demeanor, affect, thought pattern, speech is appropriate. His alert and oriented ×3. And his level of consciousness is okay. And the reason he's here today is just for a general assessment. All right, I'm going to be taking your vital signs if that's okay with you. Awesome. So first we're going to start out with blood pressure. So if you just lift your hand. Just place your arm on the table and his feet are planted. So I'm just going to put that like that. Okay, 118. /66. Okay, is that normal blood pressure for you around that range? Okay, I'll take that off. And while we're doing this, I'm just going to ask you, do you have any pain today on a scale of 0 to 10, 0 being no pain and 10 being the worst pain you've ever felt in your life?
No.
Negative for pain. And I'm just going to take your temperature really quickly. Okay, and he's at a 98.4, which is a normal temperature. And I'm just going to get your pulse ox. Yep, just put that right there. Okay, so his O2 is 96, and I'll take that off. That is a little bit low, but still within the normal ranges. So just put your palm up. I'm going to take his pulse and respirations now. Okay, so his respirations were 16 and his pulse was 76, which is around what it says with the pulse ox. So those match, so he's within normal limits for all his vital signs. Moving on to the head and neck assessment. So just looking at his head, the shape and symmetry seems to be appropriate. I would say it's normal cephalic. So next I'm going to check the hair, if that's okay with you. Just gonna touch your hair. And if you just lean forward so I can just see. Alright. So, feeling the hair, it's evenly distributed when I pulled a little bit. It was firmly attached to the scalp. And when I looked at it, there was no signs of any lesions or anything like that. Looking at the eyes, if you just look at me, they seem to be in proper alignment. And they seem to be proper prominence. Next I'm going to check Perla. So I'm just going to shine this light in your eyes a total of 4 times, and I just want you to look at the bridge of my nose, okay? Okay, so his pupils were equal, round, and reacted to light. Next, we're going to check for accommodation. So what I'm going to ask you to do is I'm going to ask you to look at the far wall, and then when I say ready, you're going to look at the tip of this pen, okay? Ready? Okay, so they did constrict. The pupils were hard to see, like the constriction, because obviously the lights are on, but they did converge. So I would say accommodation is good. And next, we're going to check for extraocular movements. So I'm just going to ask you to follow my finger, okay? Do not move your head, just move your eyes, okay? Okay, so the extraocular movements were good. So the cranial nerves 2 and 3 were shown to be intact because the Perla and cranial nerves 3, 4, and 6 were shown to be intact because his extraocular movements were appropriate. So next I'm going to check your ears. So just looking at the ears, they seem to be symmetrical, and I don't see any lesions, but I'm just going to touch them if that's okay with you. Yes, I don't feel any lesions
or lumps.
but I'm just gonna look inside for any foreign bodies or any drainage or anything like that. Okay. Come on this side. And I don't see any drainage or any foreign bodies, so that's going to be appropriate. And then next, I'm going to check your smelling. Oh, and his hearing. He has general hearing. No hearing loss. Do you have any hearing loss? Mm-hmm. Okay, so his hearing seems to be appropriate. Next, I'm going to check your smell. So, have you had any problems smelling or anything like that? That will.
I mean, I had COVID.
Okay.
I smell a little bit.
Okay, a little bit of problems with that.
Yeah.
Okay, but nothing drastic or anything. You can still smell a little bit.
Yep.
Okay. So next, I'm just going to look inside. So I'm going to touch your nose if that's okay with you. Mm-hmm. Okay. Okay, so I don't see any congestion or anything like that, or any drainage, and I didn't see any septal deviation on either side. So, alright. Okay, have you had any trouble breathing through your nose or anything like that?
No.
Okay, awesome. Alright, next we're going to be doing the mouth assessment, so I'm just going to ask you to open up your mouth real wide. Say ah. So looking inside, it's pink, moist, and intact. And are you having any loose teeth or anything like that?
No.
No problems with that, and I don't see any dentures and no missing teeth on the top. And then can you just flip your tongue up for me and open your mouth again? And no cavities on the bottom either, no missing teeth at the bottom either. His teeth look great. And there was no odor.
Or lesions.
And then can I ask you to swallow for me really quickly? Okay, and then I'm just gonna touch your trachea. And his trachea is midline. Head and neck assessment, we're going to test the gag reflex. So all I'm going to ask you to do is open up your mouth real wide. I'm going to stick this on your tongue and say ah. Okay, so obviously that was a little bit acting, but the gag reflex was appropriate.
Action.
Alright, next we're going to finish up the head and neck assessment. I'm going to feel your lymph nodes. Tell me if you feel any areas of tenderness, okay? So these are the preauricular and the postauricular and the occipital and tonsillar, submandibular and submental, superficial cervical, posterior cervical, deep cervical, and then supracervical. And I didn't feel any palpable
lymph
anything.
nodes.
Did you feel any areas of tenderness on that? No? Okay. So now I'm just gonna check your carotids. 3+ and strong. 3+ and strong. And I'm gonna ask you to take a deep breath and then exhale and then hold it for me, okay? And hold. Okay, and you can breathe again, and I didn't hear any turbulence on that, so negative for turbulence. Awesome. All right, next I'll be doing my skin assessment, so just looking at the patient, color seems appropriate for their flush down, and then I'm just gonna touch your neck, okay? And the it's warm, which is appropriate for the flush tone, or the flush, and then the moisture is appropriate, and the texture of the skin seems to be smooth, and then I'm just going to pinch your neck really quickly. And the turgor snaps back immediately, and just looking at him, I don't see any evidence of any lesions. When just inspecting the skin, normally we'd have the patient take their shirt off, but from what I can see, inspecting, there is no any present lesions that I can see. And now I'm going to proceed with my lung thorax assessment, and I'm just gonna ask you to sit up straight for me, and looking at his thorax and chest area, the size, shape, and symmetry seems to be appropriate. So now I'm just gonna touch your shoulders. And his shoulders seem to be symmetrical and even, and then popping the clavicles. Symmetrical and even, and then coming down the sternum. The sternum is vertical, no signs of deformities there, and then down the rib cage. The rib cage is symmetrical, no signs of deformities there. So next, and now I'm going to proceed with respiratory excursion. So I'm just going to place my hands in your chest, and I want you to exhale everything out, and then when I say so, you're going to take a deep breath in, and I just want you to turn your head to the side for me. And exhale, and inhale. And out. Okay, so respiratory excursion was deep and symmetrical, and so the last thing we're going to do on the anterior is I'm just going to listen to your lung sounds, and all I'm going to ask you to do is just take deep breaths through your mouth, no quicker than normal, and then if you just turn your head to the side for me, that'd be great. And ready when you are. Okay, so breath sounds were clear and even all throughout, and vesicular all throughout. So now we're going to do the posterior exam for the lung and thorax. Just looking at the back, the thorax seems to be the shape and symmetry and size seems to be appropriate for the patient. Just looking for lesions on the back, I don't see any lesions that I can see. So now I'm just going to palpate the scapula and spine. And the spine is symmetrical and vertical, no signs of deformities on the back. And so now we're going to move on to the looking for the proper S curvature on the back. So you can see the proper S curvature on the back, and then I'm just going to check for the AP versus transverse diameter. So if I take this, I go here, it's about 1/2, which is appropriate. So my breath right there, which is appropriate and expected. So now I'm going to do the same thing. I just want you to breathe everything out, and then when I say, you're going to breathe in, okay? And out, and in. Okay, and out. So respiratory excursion was deep and symmetrical. So now I'm just gonna listen to your lung sounds. I just want you to cross your arms for me, and then breathe into your mouth. No quicker than normal, and I'm ready when you are. All right, and you can breathe normally now. So I heard everything. It was deep and clear, and no signs of any adventitious breath sounds. So just to go over everything, the rate was consistent with vital signs. The rhythm was regular, and the depth was appropriate for the patient. No non-labored and no signs of accessory muscles or anything like that. And front and back were vesicular heard throughout, and no adventitious breath sounds heard on the front or the back. All right, next we're gonna move on to the cardiac assessment. So first I'm gonna start off with inspecting, looking for any pulsations, and I don't see any pulsations. So next I'm going to move on to looking for pulsations and thrills. So I'm just gonna touch you, if that's okay. So moving down to the angle of the V, and then to the aortic. I'm negative for pulsations and negative for thrills. Moving over to the pulmonic, negative for pulsations and negative for thrills. To Erb's point, negative for pulsations, negative for thrills. Fourth intercostal space, negative for pulsations, negative for thrills. Fifth intercostal space, tricuspid auscultatory site, negative for pulsations, negative for thrills. I'm going to move over to the PMI, where it is positive for pulsations and negative for thrills. At the PMI, the location is appropriate. I didn't feel it anywhere else. The rate and rhythm are consistent with vital signs. The location is in the fifth intercostal space, and diameter doesn't exceed the fifth intercostal space, and the duration is appropriate. And
Intensity is strong.
So next I'm going to move on to listening, so you can breathe normally. And this is the fourth intercostal space.
Tricuspid auscultatory site.
And moving over a half step. Another half step to the PMI. Okay. And listening through, I heard the appropriate S1 and S2 relationship going through. Again, the rhythm and rate were consistent with the vital signs. The strength was strong, and I didn't hear any extra heart sounds going through. So that finishes up the listening to the heart. So next I'm just gonna sit you up, if that's okay, if you can just sit up for me. All right, so now we're just going, after finishing the cardiac assessment, I'm just going to assess for any signs of JVD. So he's at a 45-degree angle, and I don't see any JVD, so negative for JVD. Awesome. All right, so next we're gonna do the abdominal assessment. So I'm just gonna ask you to pick up your shirt a little bit, right around there. That's good. All right, you don't have to put that high. That's good. All right, so just looking down and inspecting, I don't see any signs of abdominal distension. So next we're going to listen to the bowel sounds for a whole minute. All right. So after listening to the bowel sounds, I heard about 22, which is within that normal 5 to 34 range. So that's within normal limits. And now I'm just going to percuss, if that's okay with you.
Yeah.
Awesome. So I heard that normal abdominal tympany, so now I'm just going to palpate. And you don't have any pain in your stomach or anything?
No, I'm good.
Just let me know if you have any tenderness or pain while I'm doing this, okay? Any pain or tenderness while I did that?
Nope.
Okay, so while I was doing that, I didn't feel any lumps or lesions. He said he felt no pain or tenderness. I didn't feel any organomegaly or any bladder distension. So you can put your shirt down and sit up, and we'll talk about your bowel habits. So you haven't had any major accidents, any bowel accidents or anything like that? No? Okay. So what is the normal color that your urine is?
It's urine?
Stool.
Sorry,
What's
my
that?
bad.
No, just to clarify, brown.
Okay. Brown. And it's a normal consistency, like how would you, not too soft, not too hard,
Hard to
anything like
soft,
that?
not hard, just
Just a normal amount?
good amount.
And about how much? How much?
A
is
fair
it?
amount.
Fair amount? Or
Not too
normal
much,
amount?
not too little.
Okay. And how frequent? Like how much every day or every
Usually
week?
one or two times every day.
Okay, 1 or 2 times. And what was the last time? What was
Last night.
last bowel movement? All right, so now we're gonna move on to the urinary region. So your groin area. Have you noticed any tenderness, lumps, or lesions in your groin area?
Nothing like that.
All right, so now we're gonna move on to your bladder habits. What is the normal color of your urine?
It's like yellow.
And you haven't had any accidents recently?
No.
Okay. And then what is the clarity? So not cloudy
It's
or anything
perfectly
like
clear.
that?
It's perfectly clear.
And how much would you say?
About as much as I'm drinking in them.
Okay. And now we're gonna move on to musculoskeletal. So have you had any joint pain or anything like that?
No.
And looking over, you haven't seen any deformities? Have you noticed any deformities?
Nothing.
Nothing like that? All right, and then has your range of motion been okay?
Yeah.
No joint problems with like anything like that?
No, I'm all good.
And you haven't noticed any snaps, crackles, or pops in your joints when you move around?
Nope.
Perfect. All right, so next we're just going to assess the extremities. So just looking, if you can just put your hands like on your laps like that, just looking at the patient's skin, it's appropriate to their flesh tone. So then I'm just gonna feel a temperature. So temperature is warm on the top, and the lower extremities are also warm and normal. So now I'm just going to assess the pulses. I'm just gonna ask you to put your hands on your laps. Downwards. Actually, that works fine. Strong, 3+ and symmetrical for the radial pulses. Posterior tibialis, strong, 3+ and symmetrical. And the dorsalis pedis is strong, 3+ and symmetrical. So just what you'd expect. So I'm just going to assess capillary refill. So I'm just going to pinch your fingers. And it comes back within 2 seconds. All right. In 2 seconds. Okay. So capillary refill is normal and with under 2 seconds, and then I don't see any signs of edema on the lower or upper extremities. Did you notice any puffiness? Okay, so negative for edema.
Sure.
All right, lastly, we're gonna finish up with neurological. So I'm just gonna ask you to grip my fingers like that, and I'm gonna ask you to pull away from you and push against me. Good. So upper strength is about 5 and normal, which is normal. And then pull towards you with your legs and push away from you, and push up with your feet and push down with your feet. So I would say his lower extremities are also 5, strength and both symmetrical, upper and lower. So I'm just going to test your coordination. I'm just going to ask you to walk to that table and back. So his coordination is appropriate, and I'm going to ask you a couple questions. So do you have any numbness, tingling, pain, or decrease in sensations anywhere?
Oh, no.
You can complain about today. All right, so then lastly, we're going to test your deep tendon reflexes. All right, and next we're going to do the deep tendon reflexes. So just relax your legs, and yeah, you can hold your hands like that. All right, so that was +2, which is normal. And that was +3, that was pretty strong. So next I'm just gonna hold your arm like this and go to an angle. And we're gonna test your reflexes. This tendon. That was pretty strong, that was +3. And then on this side, just relax your arm. Also +3. So his deep tendon reflexes are appropriate and normal. And then, can you just tell me my name?
Christian.
And it was nice to meet you, and that concludes our assessment. Thank you for being my patient.